July 1893, a young victim was rushed to Providence Hospital in Chicago with a near-fatal stab wound. The victim, James Cornish, was near death with the knife still stuck in his heart. Given the state of medicine in the late 19th century, the hospital staff did not expect him to live. Chief Surgeon Daniel Hale Williams examined Cornish and confirmed the staff's fear that Cornish had sustained an unsurvivable injury. Dr. Williams, a member of Most Worshipful Prince Hall Freemasonry, was born in 1856 in Pennsylvania. His father and grandfather before him had both been barbers. When Williams was 9, his father passed away from tuberculosis, and his mother, unable to support a family, left him with relatives. He was apprenticed to a shoemaker, but ran away and joined his mother in Rockford, Illinois. From there, he moved to Janesville, Wisconsin, where he followed in the footsteps of his father and grandfather, becoming a barber. He became fascinated with the medical profession, left his job as a barber, and became an apprentice to a local physician. Eventually, he was admitted to Chicago Medical College, now known as the Northwestern University Medical School. He opened a private practice, but was constrained by the fact that at the time, black physicians were not allowed to practice in public hospitals. A man of action, Brother Williams, after much resistance, founded and opened Providence Hospital in Chicago, the first integrated such facility in the United States. It was at that hospital the young James Cornish had entered without much hope of leaving alive. Assessing the situation, Williams realized the only hope of saving Cornish was to repair the wound in his heart. At that time, operations on the heart were not thought possible. Williams knew if he attempted cardiac surgery and failed, he would be subject to criticism and might even lose his license to practice. Nonetheless, he successfully performed the surgery. It was, in fact, the first ever open heart surgery. Williams' astonishing, almost miraculous feat was not acknowledged for another 6 years. But over time, he was recognized as the first surgeon to conduct open heart surgery. His feat becomes even more impressive with the realization that he did it without the assistance of tools available to modern surgeons, such as a heart-lung machine. Dr. Williams' career was fraught with racist attacks common in that day, and he knew other black healthcare workers faced the same issues. In order to address those problems, he expanded Providence's role as a teaching hospital and training ground for other black physicians. He also founded and opened the first African American nursing school in the country. In 1893, Williams' notoriety led President Grover Cleveland to ask him to become chief surgeon at the country's first and most prominent hospital for people of color, Freedman's Hospital in Washington, D.C. Over the course of his career, Brother Williams continued to spearhead projects to further opportunities for black healthcare workers, creating additional hospitals that admitted African Americans, working as a professor of clinical surgery, and co-founding the National Medical Association for African American Doctors. In 2001, Brother Williams, who died in 1931 at the age of 75, was honored as one of the 100 greatest African Americans. And as for James Cornish, the man who would have died had Dr. Williams not made the bold decision to perform that first open heart surgery, he lived for an additional 50 years. For the Whence Came You podcast, this is Steve Harrison with the Masonic Minute.